degeneration, or, most commonly, torsion. Mature cystic teratomas affected by torsion are larger than average, mean diameter 11 cm versus 6 cm. This enlargement could be the result of the torsion rather than the cause of it. Most mature cystic teratomas can be diagnosed at US. However, the US diagnosis is complicated by the fact that these tumors may have a variety of appearances. 3 manifestations occur most commonly. The most common manifestation is a cystic lesion with a densely echogenic tubercle Rokitansky nodule projecting into the cyst lumen. Lumen. The second manifestation is a diffusely or partially echogenic mass with the echogenic area usually demonstrating sound attenuation owing to sebaceous material and hair within the cyst cavity. Outwater EK, ET. ETAL ovarian teratomas, tumor types and imaging. Imaging characteristics. Radiographics. 2001, 21. 9-year-old female patient is incidentally found to have a pelvic mass on US. The features are thought to represent those of a mature cystic teratoma, dermoid cyst. Which of the following complications relating to this diagnosis is the least likely? A. Malignant transformation. B. Associated ovarian torsion. C. Rupture of the lesion. D. Autoimmune hemolytic anemia. E. Bleeding. 55 and 11-year-old girl is currently under investigation for an adnexal mass recently found on a US scan. Which of the following statements regarding pediatric ovarian tumors is least accurate? A. Gonadoblastomas are associated with dysgenetic gonads. B. Sertoli Leydig cell tumors may present with virilizing symptoms. C. Mature cystic teratomas are the most common ovarian tumors in children. D. Immature teratomas are associated with elevated serum AFP levels. E. Elevated CA-125 levels are commonly seen in children with germ cell tumors. 21 for 75-90. 55. E. Elevated CA-125 levels are commonly seen in children with germ cell tumors. Mature cystic teratoma, often called dermoid cyst when the ectodermal elements predominate, is the most common ovarian tumor in children and adolescents, accounting for approximately 50% of all pediatric ovarian neoplasms. CA-125 levels are more frequently elevated in patients with epithelial ovarian cancers than in those with germ cell tumors, GCTs. CA-125 levels should not be routinely obtained in children, particularly in premenarcheal girls, as epithelial ovarian tumors. Chapter 8. Test paper 4, answers. 220. Are extremely rare before menarche. The serum AFP level is elevated in patients with GCTs, such as yolk sac tumors, immature teratomas, embryonal carcinomas, and mixed GCTs with yolk sac elements. HEOSH, ETAL review of ovarian tumors in children and adolescents, radiologic pathologic correlation. Radiographics. 2014, 34:2039-55. 56. E. Hemangioma. The classic hemangioma. Tumors. 56. A 36-year-old woman on oral contraceptives was sent for a liver US by her GP with complaints of right upper quadrant pain and fullness. No gallstones were found and bile ducts were normal. However, an incidental small hyperechoic lesion was discovered in the right lobe of the liver. The appearance was benign, and the most likely diagnosis would be A. Focal nodular hyperplasia. B. Hepatocellular adenoma. C. Biliary hamartoma. D. Angiomyolipoma. E. Hemangioma. 50. Hemangioma is an asymptomatic lesion that is discovered at routine examination or autopsy. At US, the typical appearance is a homogeneous, hyperechoic mass with well-defined margins and posterior acoustic enhancement. The CT findings consist of a hypoattenuating lesion on non-enhanced images. After intravenous administration of contrast material, arterial phase CT shows early, peripheral, globular enhancement of the lesion. The attenuation of the peripheral nodules is equal to that of the adjacent aorta. Venous phase CT shows centripetal enhancement that progresses to uniform filling. This enhancement persists on delayed phase images. At MR imaging, hemangiomas are characterized by well-defined margins and high signal intensity on T2 weighted images, which is identical to that of cerebrospinal fluid. Specificity is improved by using serial gadolinium-enhanced gradient echo imaging. The gadolinium intake is similar to the intake of iodinated contrast material during enhanced CT. With T2 weighted spin echo and dynamic gadolinium-enhanced T1 weighted gradient echo sequences, the sensitivity and specificity of MR imaging are 98% and the accuracy is 99%. The imaging features of a hemangioma depend on its size. Typical hemangiomas are mostly less than 3 cm in diameter. Vilgrain v. ETAL imaging of atypical hemangiomas of the liver with pathologic correlation. Radiographics. 2020:37997. 57. A 43-year-old man with known history of arteriovenous malformation involving various organs had a chest X-ray following a recent bout of hemoptysis. The chest X-ray was abnormal, and a CTPA was organized for clarification/confirmation and help in treatment planning. All of the following CT findings are true regarding treatment of pulmonary AVM, except A. Surgery is preferred over embolization. B. Coils are the preferred embolization material. C. Intolerance to exercise is an indication for treatment. D. Aneurysm size greater than 2 cm needs to be treated. E. Large feeding arteries are associated with increased risk of brain abscess. 58. An 81-year-old 97. 57. A. Surgery is preferred over embolization. Treatment of pulmonary AVMs is with either surgery or embolotherapy, with the latter being the preferred option. Indications for treatment include intolerance to exercise, aneurysms greater than 2 centimeters in diameter, or feeding arteries of 3 millimeters or larger, which are associated with increased risk of stroke and brain abscess. Coils and amplots of plugs are used for large vessel permanent occlusion, like embolization of pulmonary AVM. Labarsky M. ETAL embolization agents which one should be used when. Part 1. Large vessel embolization. Semen intervent radiol. 2009, 26, 43527. Pool PS, Ferguson EC, revisiting pulmonary arteriovenous malformations, radiographic and CT imaging findings and corresponding treatment options. Contempt diagnose radiol. 2010, 33, 815. 81-year-old man with progressive worsening hesitancy, dribbling, incomplete voiding and hematuria was found to have a hard nodular prostate gland on digital rectal examination. He is due to have a staging prostatic MRI, which will take place shortly after truss biopsy. Which one of the following is characteristic of post-biopsy hemorrhage of the prostate gland on MR imaging? A. Hyperintense on T1W imaging and hypointense on T2W imaging. B. Hypointense on T1W imaging and hypointense on T2W imaging. C. Hypointense on T1W imaging and hyperintense on T2W imaging. Chapter 7. Test paper 4, questions. 191. D. Hyperintense on T1W imaging and hyperintense on T2W imaging. E. Hyperintense on T1W imaging and isointense on T2W imaging. 58. A. Hyperintense on T1W imaging and hypointense on T2W imaging. T1. Weighted images are important in prostate cancer staging because they show the presence of hemorrhage secondary to a recent biopsy. Hemorrhage is almost always hyperintense compared with normal parenchyma on T1, weighted MRI. Hemorrhage typically appears low in signal on T2, weighted MRI and mimics cancer. Turk BB, ETAL imaging techniques for prostate cancer, implications for focal therapy. Nat Rev Urol. 2009, 6, for 191-203. 59. D. Paget disease, acute phase. Paget disease is a multifocal skeletal imaging. 59. A 52-year-old man has a lower leg radiograph performed after a fall. No acute bony injury is identified, but the reviewing doctor notices a flame-shaped lucency involving the medulla of the tibia, extending superiorly from the distal subarticular into the diaphysis. He is unsure of the significance of his appearance and seeks the opinion of the radiologist. Which of the following is the most likely diagnosis? A. Osteomyelitis. B. Giant cell tumor. C. Plasmacytoma. D. Paget disease, acute phase. E. Paget disease, chronic phase. Skeletal condition whereby bone remodeling becomes abnormal and eventually exaggerated. It typically affects middle-aged to elderly people and has acute and chronic phases with different radiographic appearances. The acute phase, also known as the active or osteolytic phase, is characterized by aggressive bone resorption secondary to disordered osteoclastic activity. This manifests as lucency within the medulla of the long bones, typically in a flame shape or blade of grass configuration. Over time, osteoblastic activity overtakes the osteoclastic resorption. Chapter 8. Test paper 4, answers. 221. Resulting in osteosclerosis, cortical thickening, and increased trabeculation. Trabeculation. Giant cell tumor is a benign neoplasm of the mature skeleton, seen almost exclusively in those under 30 years of age. Although osteomyelitis can result in bony lucency, it is typically patchy with a moth-eaten texture. Dannert W. Radiology Review Phase. A 40-year-old woman with history of severe diarrhea following salmonella gastroenteritis presented with increasing headache. Clinically bilateral papilloedema was noted. Acute drop in GCS prompted an urgent CT of the brain, which showed suspicious high density in the superior sagittal sinus with bilateral subcortical hemorrhages in the parietal lobes. What is your diagnosis? A. Acute hemorrhagic infarct. B. Encephalitis. C. Meningeal metastasis. D. Superior sagittal sinus thrombosis. E. Transverse sinus thrombosis. W. Radiology Review Manual. 6th N. Philadelphia, Pa, Lippincott, Williams and Wilkins, 2007:145. 60. D. Superior sagittal sinus thrombosis in neonates. Shock and dehydration is a common cause of venous sinus thrombosis. In older children it is often local infection. In adults, coagulopathies are more common than infection. In women, OCP use and pregnancy are strong risk factors. Imaging findings of cerebral venous thrombosis can be categorized as direct, as when there is visualization of cortical or dural sinus thrombus, delta sign on unenhanced CT, and empty delta sign on post-contrast CT venogram, or indirect, as when there are ischemic or vascular changes related to the venous outflow disturbance. Venous infarction manifests as a low attenuation lesion with or without subcortical hemorrhage. Brain lesions are related to a venous distribution. Bilateral parasagittal hemispheric lesions are suggestive of superior sagittal sinus thrombosis. Ipsilateral temporooccipital and cerebellar lobe. Lesions can be found in transverse sinus thrombosis. In bilateral thalamic lesions, deep cerebral. Venous thrombosis should be suspected. Rodalic MH, ETAL cerebral venous thrombosis and multi-detector CT angiography, tips and tricks. Radiographics. 2006, 26 Supple 1, S518, discussion S42-3. Simon. Thrombosis. 61, a 42-year-old woman was found to have a mass in the right lobe of the liver on US and sent for an MRI liver for further characterization. All of the following are expected Mr. features of FNH, except A. High signal intensity of the central scar on T2W images. B. Uniform enhancement of the mass in the arterial phase. C. Lack of capsular enhancement in the arterial phase. D. Hypointense to surrounding liver on the enhanced portal venous phase. E. Maximum intensity of central scar on enhanced delayed phase image. Simons B. ETAL cerebral venous thrombosis. Radiology assist. Assistant. http://www.radiologyassistant.nl/enp. P for Bifac 3E4691/cerebral venous thrombosis.html. HTML accessed on February 18, 2017. HTML accessed on February 18, 2017. 61. D. Hypointense to surrounding liver on the enhanced portal venous phase. Typically, FNH is ISO, or hypointense on T1, weighted images, is slightly hyper, or isointense on T2, weighted images, and has a hyperintense central scar on T2, weighted images. FNH shows intense homogeneous enhancement in the arterial phase, and enhancement of the central scar in the later phases of gadolinium-enhanced imaging. FNH does not have a tumor capsule, although the pseudocapsule surrounding some FNH lesions may be quite prominent. The pseudocapsule of FNH results from compression of the surrounding liver parenchyma by the FNH, perilesion vessels, and inflammatory reaction. The pseudocapsule is usually a few millimeters thick and typically shows high signal intensity on T2, weighted images. The pseudocapsule may show enhancement on delayed contrast-enhanced images. A central scar is present at imaging in most patients with FNH. The amount of scar tissue within FNH and the size of the central scar may vary. The central scar is typically high in signal intensity on T2, weighted images, and low in signal intensity on T1, weighted images. It shows visible enhancement on delayed contrast-enhanced images. High signal intensity of the central scar may be caused by the inflammatory reaction around the ductular proliferation, as well as the vessels within the septa and central scar. The central scar is not a specific finding of FNH, and can be seen in a variety of other focal liver lesions, such as giant hemangiomas. Hussein SM, ETAL focal nodular hyperplasia, findings at state-of-the-art MR imaging, US, CT, and pathologic analysis. Radiographics. 2004, 24:319. 62. C. Osler-Rondeau-Weber syndrome. Images. 62. A 57-year-old woman with a personal and familial father, brother and grandfather, history of epistaxis, and multiple telangiectasia, presented with dyspnea and weakness leading to performance of a chest and head CT scan which showed a peripheral lobulated enhancing mass in the thorax and areas of hypoattenuation in the brain. A. Churg-Strauss disease. B. Wegener's granulomatosis. C. Osler-Rondeau-Weber syndrome. D. Metastatic choriocarcinoma. E. Kaposi sarcoma. 63. CT of the pelvis in a 37. Osler-Rondeau-Weber syndrome is an uncommon genetic disorder characterized by arteriovenous malformations in the skin, mucous membranes, and visceral organs. Organs. The brain, gastrointestinal tract, skin, lung, and nose are the primary sites affected. Pulmonary AVM typically appears as a round or oval mass of uniform density, which can be lobulated but with well-circumscribed and sharply defined margins. The feeding arteries are seen radiating from the hilum of the lung, and the draining veins are seen coursing towards the left atrium. Chapter 8. Test paper 4, answers. 222. Multiple ischemic strokes in different arterial territories at different ages characterize the embolic mechanism in HHT. Brain abscess is the most serious neurologic complication in PAVM. Typically in HHT these abscesses are multiple and recurrent, affecting the superficial layers of the cerebral lobes, mostly the parietal lobe. Correct MF, ETAL imaging of hereditary hemorrhagic telangiectasia. Cardiovasc intervent radiol. 2009, 32, for 74557. Pool PS, Ferguson EC, revisiting pulmonary arteriovenous malformations, radiographic and CT imaging findings and corresponding treatment options. Contempt diagnose radiol. 2010, 33, 81. 37-year-old woman who was undergoing ovulation induction showed massive cysts. Cysts in the pelvis surrounding a core of central ovarian stroma with relatively higher attenuation. More cephalad images demonstrated ascites. All of the following are features of ovarian hyperstimulation syndrome, except A. Enlarged multicystic ovaries B, free intraperitoneal fluid C, low serum estradiol levels D, pleural or pericardial effusion E, risk of deep vein thrombosis. 15. 63. C. Low serum estradiol levels. Ovarian hyperstimulation syndrome is usually iatrogenic secondary to ovarian stimulant drug therapy for infertility, but may occur as a spontaneous event in pregnancy, and is associated with raised serum estradiol levels. The syndrome consists of ovarian enlargement with extravascular accumulation of exudates leading to weight gain, ascites, pleural effusions, intravascular volume depletion with hemoconcentration, and oliguria in varying degrees, with increased risk of thrombosis and stroke. Pain, abdominal distension, nausea, and vomiting are frequently seen. The imaging findings are similar at US, CT, and MR imaging, and reflect ovarian enlargement by distended corporal luteal cysts of varying sizes. Because the enlarged follicles are often peripheral in location, a spoked wheel appearance has been described. Ascites, pleural effusion, and pericardial effusion are also described. Familiarity with ovarian hyperstimulation syndrome and the appropriate clinical setting should help avoid the incorrect diagnosis of an ovarian cystic neoplasm. Bennett GL, ETAL gynecologic causes of acute pelvic pain, spectrum of CT findings. Radiographics. 2002, 22, for 785-801. Chapter 7. Test paper 4, questions. 192. 64, a 15-year-old boy, who is a keen footballer, has a radiograph taken of the left knee following a tackle. There is an area of periosteal reaction and irregular speculated periosteum at the posterior aspect of the distal femur just proximal to the physis. He denies any symptoms before the injury. The next imaging should be which one of the following? A. A comparison radiograph of the contralateral knee B, non-contrast CT of the distal femur C, contrast-enhanced CT of the distal femur D, MRI of the distal femur E. A nuclear medicine bone scan. 65, a 16-year-old boy with learning difficulties presented to the A&E department with increasing frequency of epileptic fits. 801. 64a. A comparison radiograph of the contralateral knee. The appearance is likely to represent post-traumatic cortical desmoid. It is also known as avulsive cortical irregularity or Buffkin lesion. It results from chronic avulsive stress at the femoral region of the medial head of the gastrocnemius. It is usually an incidental finding. 1/3 of cases are bilateral, and a comparison photograph of the contralateral knee is helpful to assess the other side. If plain films are not helpful, an MRI can be useful to assess soft tissues. Post-traumatic cortical desmoid does not involve soft tissues. Adam A. ETAL Granger and Allison's Diagnostic Radiology, a textbook of medical imaging. 5th ed. New York, Churchill Livingstone, 2008:1783. Fits, which he has had since childhood. Bilateral brisk reflexes were noted clinically. CT of the brain performed to exclude hemorrhage revealed a large heterogeneous lobulated mass replacing the third ventricle with further areas of subependymal calcification. What is the diagnosis? A. Sturge-Weber syndrome. B. Tuberous sclerosis. C. Arnold-Chiari malformation. D. Neuroblastoma metastasis. E. VHL. 1783-4. 65. B. Tuberous sclerosis. Tuberous sclerosis is a neuroectodermal disorder characterized by the classic triad of adenoma sebaceum, seizures, and mental retardation. CNS findings include subependymal hematomas, which can calcify, classic calcified subependymal nodules, giant cell astrocytoma, at the foramen of Monro, often replacing the third ventricle, cortical tubers, and heterotopic islands of gray and white matter. Pulmonary involvement includes interstitial fibrosis at lung bases, LAM, multiple lung cysts, and chylothorax. Cardiac involvement includes rhabdomyoma, aortic aneurysm, and congenital cardiomyopathy. Renal involvement includes AML, cysts, and RCCs. Ocular lesions include optic nerve glioma and hamartoma. Other visceral abnormalities include splenic tumor and pancreatic and hepatic adenomas. Dannert W. Radiology Review Manual. 66. A previously fit and healthy 16-year-old presents with recurrent wheeze. Chest X-ray demonstrates tubular, branching structures of increased density relative to normal lung radiating from the left hilum. The surrounding lung is hyperlucent. What is the most likely diagnosis? A. Allergic bronchopulmonary aspergillosis. B. Cystic fibrosis. C. Bronchial atresia. D. Cartagena syndrome. E. Swyer-James syndrome. 7th ed. Philadelphia, Pa, Lippincott, Williams and Wilkins, 2011, 333-5. 66. C. Bronchial atresia. This is the classic description of a mucocele. Congenital bronchial atresia is a congenital abnormality caused by focal interruption of a lobar, segmental or subsegmental bronchus with. Chapter 8. Test paper 4, answers. 223. Associated peripheral mucus impaction, bronchocele/mucocele, and associated hyperinflation of the obstructed lung segment. The apico-posterior segmental bronchus of the left upper lobe is most commonly affected. The condition is usually benign and asymptomatic and is often an incidental chest X-ray finding. Mean age at diagnosis is 17 years and symptoms, if present, include recurrent pulmonary infection, mild wheeze and dyspnea. The typical appearance of Swyer-James syndrome is that of a small, hyperlucent lung with overexpansion of the contralateral lung. A diffuse pattern of scarring or irregular vessels may also be present. Cystic fibrosis is unlikely in a previously well individual. Cartagena syndrome appears as bilateral bronchiectasis. Allergic bronchopulmonary aspergillosis is a possibility, but the minor symptoms fit best with bronchial atresia. Dannert W. Radiology Review Manual. 7th ed. Philadelphia, Pa, Lippincott, Williams and Wilkins, 2011:481. 67. D. The most common malignant germ cell tumor is a dysgerminoma. Germ cell tumors are the most common type of ovarian neoplasm, with 1/3 of these being malignant in children and adolescents. A dysgerminoma is the most common malignant germ cell tumor and is associated with gonadal dysgenesis. 67. A 14-year-old female patient is found on U.S. to have a large pelvic mass comprised of mainly cystic elements. The right ovary is not seen separate to the mass. With regard to adnexal masses in Masses in children, which of the following statements is true? A. Mature cystic teratomas tend to be bilateral when present. B. A raised serum AFP level is indicative of choriocarcinoma. C. The majority of mature cystic teratomas are malignant. D. The most common malignant germ cell tumor is a dysgerminoma. E. Yolk sac tumors tend to have a benign clinical course. 60. Dysgenesis. The majority of germ cell tumors are mature cystic teratomas, also known as dermoid cysts, which account for 50% of all pediatric ovarian neoplasms. These are bilateral in 10% of cases. HEOSH, ETAL review of ovarian tumors in children and adolescents, radiologic. 68, a 33-year-old lady with a history of right upper quadrant pain and deranged LFTs is sent for an ultrasound, which shows a large cystic lesion in the right liver lobe. Blood tests also show eosinophilia. Eosinophilia. Which of the following statements regarding the imaging of hydatid disease is false? A. U.S. findings are variable and range from purely cystic to solid-appearing pseudotumors. B. Daughter cysts are frequently seen. C. Cysts usually appear well-defined on CT. D. Coarse wall calcification may be present. E. CT imaging best demonstrates the pericyst, matrix, and daughter cysts. Radiologic pathologic correlation. Radiographics. 2014, 34:2039-55. 68. E. CT imaging best demonstrates the pericyst, matrix, and daughter cysts. Hydatid disease is a severe and common parasitic disease that is endemic to the Mediterranean basin and other sheep-raising areas. Humans become infected by ingesting the eggs of the tapeworm Echinococcus granulosus, either by eating contaminated food or from contact with dogs. The ingested embryos invade the intestinal mucosal wall and proceed to the liver via the portal venous system. Although the liver filters out most of these embryos, those that are not destroyed become hepatic hydatid cysts. U.S. findings are variable and range from purely cystic to solid-appearing pseudotumors. Wavy bands of delaminate endocyst, water lily sign, may be noted internally. Daughter cysts, sometimes surrounded by echogenic debris matrix, are frequently seen. Calcifications, varying from tiny to massive, are often present peripherally. At CT, a hydatid cyst usually appears as a well-defined, hypoattenuating lesion with a distinguishable wall. Coarse wall calcifications are present in 50% of cases, and daughter cysts are identified in approximately 75%. Because of its superb contrast resolution, MR imaging best demonstrates the pericyst, the matrix or hydatid sand debris consisting of freed scolices, and the daughter cysts. The pericyst is seen as a hypointense rim on both T1 weighted and T2 weighted images because of its fibrous composition and the presence of calcifications. The hydatid matrix appears hypointense on T1 weighted images and markedly hyperintense on T2 weighted images. When present, daughter cysts are hypointense relative to the matrix on both T1 weighted and T2 weighted images. Mortelli KJ, ETAL. The infected liver, radiologic pathologic correlation. Radiograph. A. Mature cystic teratomas tend to be bilateral when present. B. A raised serum AFP level is indicative of choriocarcinoma. C. The majority of mature cystic teratomas are malignant. D. The most common malignant germ cell tumor is a dysgerminoma. E. Yolk sac tumors tend to have a benign clinical course. 68. A 33-year-old lady with a history of right upper quadrant pain and deranged LFTs is sent for an ultrasound, which shows a large cystic lesion in the right liver lobe. Blood tests also show eosinophilia. Which of the following statements regarding the imaging of hydatid disease is false? A. U.S. findings are variable and range from purely cystic to solid-appearing pseudotumors. B. Daughter cysts are frequently seen. C. Cysts usually appear well-defined on CT. D. Coarse wall calcification may be present. E. CT imaging best demonstrates the pericyst, matrix, and daughter cysts. 69. 69. A 50-year-old man with known lung transplant presented with shortness of breath. Blood gases revealed type 1 respiratory failure. A late post-transplant complication was suspected. Chapter 7. Test paper 4, questions. 193. And a baseline chest X-ray was organized as a start. All of the following are late complications of lung transplantation, except A. Bronchial stenosis. B. Chronic rejection. C. Recurrence of primary disease. D. Cryptogenic organizing pneumonia. E. Bronchial dehiscence. Radiographics. 2004, 24:937:55. 69. E. Bronchial dehiscence. Immediate complications, 24 hours, malpositioned monitoring tubes and lines donor recipient size mismatch hyperacute rejection. Early complications, 24 hours to 1 week, ischemia reperfusion injury, reperfusion edema, acute pleural complications. Chapter 8. Test paper 4, answers. 224. Intermediate complications, 8 days to 2 months, acute rejection bronchial anastomotic complications like dehiscence infections. Primary late complications, 2-4 months, bronchial stenosis and bronchomalacia viral infection pulmonary embolism and infarction complications that affect the native lung. Lung. Secondary late complications, greater than or equal to 4 months. Mycobacterial infection chronic rejection cryptogenic organizing pneumonia post-transplantation lymphoproliferative disorder upper lobe fibrosis recurrence of primary disease bronchogenic carcinoma. Krishna Ms. post-operative. Mycobacterial infection, chronic rejection, cryptogenic. A 37-year-old woman in her third trimester presented to the labor ward with acute onset of pain in the lower central abdomen. She had had 2 previous cesarean sections and an appendectomy with unremarkable recovery. On clinical examination, there was definite tenderness at the site of a previous cesarean scar. The best imaging modality for evaluation of cesarean section scar dehiscence is A, CT, B, transabdominal USC, MRI D, angiography E, transvaginal US. Cryptogenic organizing pneumonia post-transplantation lymphoproliferative disorder upper lobe fibrosis recurrence of primary disease bronchogenic carcinoma. Krishna-Ms post-operative complications of lung transplantation, radiologic findings along a time continuum. Radiographics. 2007, 27, for 95774. 70. C. MRI uterine dehiscence is characterized by incomplete rupture of the uterine wall, usually involving the endometrium and myometrium, but with an intact overlying serosal layer. MR imaging may be better than CT in evaluating for uterine dehiscence because of its multiplanar capability and greater soft tissue contrast, and its ability to help identify an intact serosal layer. Rogers SK, ETAL imaging after cesarean delivery, acute and chronic complications. Radiographics. 2012, 32. U.S. 71. A 23-year-old man presents with an acute injury of his knee sustained during a friendly football match following a rough tackle. The patient reports having heard a pop, and the knee started swelling immediately. He is unable to weight bear and had to be carried off the field. An MRI is organized with high suspicion of ACL injury. All of the following are indirect signs of ACL injury, except A, bone bruising in lateral tibiofemoral compartment, B, deep lateral femoral sulcus greater than 1.5 mm, C, uncovering of the posterior horn of the lateral meniscus, D, posterior translation of the tibia, E, PCL bowing, 105. 32, 616, 93, 712. 71, D, posterior translation of tibia and ACL injury results in anterior translation of the tibia. The kissing contusions from a pivot shift mechanism of injury results in marrow edema in the posterolateral region of the tibial plateau and the mid portion of the lateral femoral condyle. A deep lateral femoral sulcus, more than 1.5 millimeters, may be appreciated on plain film. Uncovering of the posterior horn of the lateral meniscus is associated with the anterior translation of the tibia. The PCL tends to buckle after an ACL injury resulting in a reduced PCL angle less than 105 degrees. NGWA, ETAL imaging of the anterior cruciate. Cruciate ligament. World J. Orthop. 2011, 2, 875-84. Sanders T.G., ETAL bone contusion patterns of the knee at MR imaging, footprint of the mechanism of injury. Radiographics. 2020, S13551. 72, C, basal meningitis suggests neurosyphilis. The finding of diffuse cerebral atrophy in 105 degrees. 72, MRI brain images of a 42-year-old man diagnosed with HIV showed areas of cloud-like high signal on T2W images in the periventricular area bilaterally. All of the following are true regarding CNS infections in HIV, except A, high signal in the periventricular area suggests HIV subacute encephalitis. B, subacute encephalitis caused by HIV and CMV have similar appearances. C, basal meningitis suggests neurosyphilis. D, cerebral infarcts can occur with neurosyphilis in HIV patients. E, CMV infection can manifest as ventriculoencephalitis. 73, in HIV can be accompanied by diffuse, confluent, ill-defined areas of abnormally increased signal intensity on T2, weighted Mr. images of the periventricular white matter. No enhancement is noted. These findings were initially attributed to CMV infection, as autopsy studies have shown that a high percentage of AIDS patients had concomitant CMV infection of the CNS. It was subsequently recognized that HIV is neurotrophic and directly infects the CNS. These global abnormalities were then attributed to a subacute encephalitis caused by HIV. It now seems likely that both HIV and CMV can cause subacute encephalitis and encephalopathy. These conditions have an identical nonspecific imaging appearance. CMV encephalopathy appears to manifest itself late in the illness, whereas Chapter 8. Test Paper 4, Answers. 225. HIV rather than H1V dementia, although usually presenting late, can occasionally be the AIDS-defining illness. In addition to subacute encephalitis, CMV infection can manifest as a more virulent ventriculoencephalitis. This is most often seen in concert with CMV infection elsewhere in the body, such as CMV retinitis, and is usually a late manifestation of AIDS. The infection appears to begin in the ependymal or subependymal region and spread into the adjacent brain. The ventricles are enlarged and hypoattenuation on CT, or increased signal intensity on T2, weighted MRI is noted in the periventricular white matter. Ill-defined periventricular enhancement can also be seen following injection of contrast medium. Meningitis, particularly basilar meningitis, and hydrocephalus occur often in the setting of neurotuberculosis. Meningitis manifests on CT scans and MR images as prominent enhancement and thickening of the meninges, and it can be associated with infarct secondary to vascular stenosis or occlusion. Neurosyphilis, which is being diagnosed with increased frequency among patients with AIDS, can cause infarct secondary to arteritis. Wallet ETAL neuroimaging findings in patients with AIDS. ClinInfect DIS 1996, 22, 690619. 73, D. Hilar lymph nodes are more common in MRSA radiological findings. A 74-year-old woman presented with postoperative gastric cancer, and for days after onset of fever, cough, and sputum. CT was organized for characterization. All of the following are true regarding MRSA and MSSA pneumonia on CT chest, except A. Lung nodules are more common in MSSA. B. Effusion is more common in MRSA. C. There is no significant difference in zonal distribution between MSSA and MRSA pneumonia. D. Hilar lymph nodes are more common in MRSA. E. Consolidation is seen in both groups. Findings of MRSA pneumonia reported in the current literature are limited to descriptions of necrotizing pneumonia. The frequencies of bronchial wall thickening and centrilobular nodules were significantly higher in patients with MSSA than MRSA pneumonia. Moreover, the frequency of centrilobular nodules with a tree and bud pattern was significant. Significantly higher in patients with MSSA than MRSA pneumonia. There were no significant differences in other CT findings, including ground glass opacity and consolidation between the two groups. Ground glass change and bronchial wall thickening were the two most common CT findings in both groups. There were no significant differences in zonal distributions between the two groups. Both groups showed unilateral or bilateral opacities and predominantly upper zone changes. The frequency of pleural effusion was significantly higher in patients with MRSA than in those with MSSA pneumonia. There was no difference in hilar or mediastinal lymphadenopathy. Morikawa K, ETAL methicillin-resistant Staphylococcus aureus and methicillin. 74, a 4-year-old girl presents with progressive enlargement of her right thigh, with episodes of unprovoked bleeding from pigmented lesions over her right thigh, which were present since birth. A lower limb venogram of the right leg demonstrates absence of the deep. Chapter 7. Test Paper 4, Questions. 194. Venous system, with varicose veins on the lateral aspect of the right leg. Which of the following is the most likely diagnosis? A. Klippel-Trenaunay syndrome. B. Neurofibromatosis type 1C, Beckwith-Wiedemann syndrome. D. Macrodystrophy lipomatosis. E. Maffucci syndrome. Methicillin susceptible S. Aureus pneumonia. Comparison of clinical and thin section CT findings. BRJ Radiol. 2012, 85, 1014 E16875. 74. A. Klippel-Trenaunay syndrome. Klippel-Trenaunay syndrome is a sporadic rare mesodermal abnormality that usually affects a single lower limb. It is characterized by a triad of a port wine nevus, unilateral cutaneous capillary hemangioma, often in a dermatomal distribution on the affected limb, overgrowth of distal digit/entire extremity involving soft tissue and bone, and varicose veins on the lateral aspect of the affected limb. Although the other options can produce limb hypertrophy, they would not be expected to show all the features of the triad described. Oyong KM, ETAL Klippel-Trenaunay syndrome presenting in a child with vascular malformation. J. Hong Kong Call Radiol. 2002, 5:2279. Danner syndrome. 75, a 42-year-old man with epigastric pain and upper abdominal fullness was sent for U.S. assessment. No gallstones were observed and bile ducts were normal. Multiple tiny liver lesions were noted and an MRI was advised for characterization. Characterization. MRI was reported as biliary hematomas, von Meyenberg complexes, VMC, of the liver.
अस्सलामुअलैकुम। मामाज लाइफ ओकेयर में वेलकम है।